OrtoWell is a development company focusing on solutions for spinal surgery. OrtoWell has developed the OrtoWell system for the implantation of spinal disc prostheses. The OrtoWell system facilitates removal of degenerated discs and helps provide accurate positioning of a disc prosthesis in the spinal column. The system is applicable to a range of commercially available prostheses. The main component of OrtoWell is a hydraulic system which attaches to the spine with bone screws. The system grips the screws via maneuverable pivoted joints. This connection provides full flexibility to optimally position the screws according to the surgeon's preference. 4 orthopedic screws are positioned close to the end plates of the 2 vertebrae that are adjacent to the degenerated disc. Soft tissues are prevented from hooking on the screw threads by protective tubes. The screws penetrate the entire vertebra and only indent the rear cortical shell enough for stabilization. A correct and secure positioning of each screw is ensured with the help of X-ray imaging. Spacer rings are slid onto the bone screws just prior to attaching OrtoWell. OrtoWell is attached to the screws and can be positioned at any height desired along the screws. The spacer rings guarantee a minimum distance between OrtoWell and the vertebrae. Thanks to the flexibility of the pivoting joints, OrtoWell's connections adapt to the angle of the screws. This provides full flexibility to position the screws in a way that is anatomically preferred. After positioning OrtoWell, the desired angles and height are locked with special hand tools. The tops of the screws are covered during surgery. OrtoWell's cylinders are used to attach soft tissue retractors that are X-ray translucent. The retractors are separated and kept apart with a sliding, expandable frame. The purpose of the retractors is to reduce the depth of the surgical region and to improve access to the spine. OrtoWell separates the vertebrae with the help of a hydraulic system. Hydraulic control units are coupled to the system's hydraulic tubes. Using a rotating handle, the separation force is controlled manually. As the handle is turned, the hydraulic piston extends to separate the vertebrae. Now, full access to the degenerated disc is available and disc removal can begin. OrtoWell keeps the vertebrae apart during removal of the degenerated disc. Contraction of the vertebrae is thus prevented and full access and visibility are achieved during the entire disc removal procedure. Throughout the mobilization procedure, the surgeon has complete visibility over the rear parts of the disc. Mobilization is performed by the instrument alone without the use of bending tools, thus avoiding damage to the end plates. The widening of the disc space allows insertion of the disc prosthesis between the vertebrae without any force. The position is controlled by X-ray imaging, and adjustments to the position can easily be performed if necessary. OrtoWell's OrtoWell system is a surgical solution for the secure and accurate positioning of artificial spinal disc prostheses.